Now, in the second section of our lecture, let's talk about the referred causes of otalgia. As I mentioned in the first section, some causes of the referred otalgia. Now, let's talk about them in little detail, how they can cause otalgia. So, we will talk about the referral of from the cranial nerve 5, fifth cranial nerve, and then the referral from 9th and 10th cranial nerve, and via C2, C3, and then spinal nerves. First, the fifth cranial nerve. We have 12 cranial nerves in the body. 12 cranial nerves, which is olfactory, is the first cranial nerve. Then we have optic, oculomotor, trochlear. And then fifth one, when we say fifth cranial nerve, we are talking about trigeminal nerve. So we have olfactory, optic, oculomotor, trochlear, trigeminal. Trigeminal is the fifth cranial nerve. So how the fifth cranial nerve, which is the trigeminal nerve, cause the referral pain of the referral pain to the ear or cause otalgia. So dental, these are all the sites which are mainly responsible for causing otalgia as a result of involvement of fifth cranial nerve, which I said is the trigeminal nerve. So fifth, from the mandible, then from the tongue or oral cavity basically, and then from the dental or from the teeth. So dental causes that can lead to otalgia as a result of involvement of fifth cranial nerve. We have dental caries, very common cause when there is bacteria or infection of the teeth. So caries, tooth, apical abscess, any abscess in the teeth, impacted molar, malocclusion, and Costin syndrome. So these are the common causes, dental causes of otalgia or pain in the ear. Next, we have an oral cavity. By the fifth nerve, we have benign or malignant ulcerative lesion of oral cavity or tongue. So whenever there is ulceration in the oral cavity, in the mouth or tongue, these pains are also referred to the ear. Then the temporomandibular joint disorder, this is the mandible. So when we have, and this joint here is the temporomandibular joint. So temporomandibular joint disorder like bruxism, osteoarthritis, recurrent dislocation, and ill-fitting dentures. So all these can cause otalgia also, all these disorders of the temporomandibular joint. Then we have sphenopalatine neuralgia. Sphenopalatine neuralgia. This can also cause the pain in the ear or otalgia. So all these different sites, because they are innervated by fifth cranial nerve, which is the trigeminal nerve, can lead to otalgia or pain in the ear. Dental, oral cavity, temporomandibular joint disorder, and sphenopalatine neuralgia. Next, we are 10th cranial nerve. 10th cranial nerve, any malignancy or ulcerative lesion of vallicula, epiglottis, larynx or laryngopharynx, and esophagus. So 10th cranial nerve, all these areas are involved, in which we have the vallicula. Vallicula is the empty space at the back of the tongue. Epiglottis, larynx, or larynx is the sound box, or laryngopharynx, and esophagus. All these, any ulceration of these structures can cause referred pain to the ear because they are innervated by the 10th cranial nerve. So involvement of 10th cranial nerve leads to otalgia. So as I mentioned, trigeminal was the 5th cranial nerve. So let's see, 5th, 10th is, we have olfactory, optic, oculomotor, trochlear, trigeminal, then we have abducent, facial, vestibulocochlear, glossopharyngeal, vagus. So our 10th cranial nerve is the vagus nerve. So this 10th cranial nerve, involvement of the vagus nerve cause otalgia because all these structures, larynx, laryngopharynx, esophagus, they are innervated by the vagus nerve, which is the 10th cranial nerve. Let's talk about the referred pain from the C2 and C3 spinal nerves. Our vertebral column is divided into different sections. We have cervical vertebra in the neck. Below the cervical vertebra, we have thoracic vertebra, then lumbar, sacral, and then coccygeal vertebra. In between these vertebra, one on each side, we have the spinal nerves coming and innervating different parts of the body. So cervical 2 and 3, they are the two first, second and third cervical spinal nerves. They are again very referred easily pain to the ear, and otalgia can occur. So cervical, any condition like cervical spondylosis, injuries of cervical spine and Cary's spine. So whenever there is a compression of the nerve, spinal nerve between the vertebra, it can cause referred pain, and it can cause involvement of different organs, parts which are innervated by those spinal nerves. So any injury of the neck, any cervical spondylosis and Cary's spine can cause otalgia. Now let's talk about the effect of the ninth cranial nerve on the otalgia. Our ninth cranial nerve is glossopharyngeal nerve. So as the name shows, glossal is for the tongue. So any involvement of the tongue as a result of ninth cranial nerve involvement, and pharyngeal, glossopharyngeal. So any area of the throat, if you see in this diagram, we have epiglottis, and then the vocal cords involvement can cause pain in the ear, otalgia, and it is transferred to the auditory nerve, and then from the auditory nerve, inner ear, middle ear, and then so all this is the ninth cranial nerve. So oropharynx, involvement of the oropharynx, like acute tonsillitis, inflammation of the tonsils in the neck, any peritonsillar abscess around the tonsil, if there is formation of the abscess as a result of any infection, cause otalgia. Then tonsillectomy, removal of the tonsils, benign or malignant ulcers of soft palate tonsils and its pillar. So glossopharyngeal nerve, involvement of the oropharyngeal region, including tonsillitis, and then any ulcers in the palate tonsil can cause otalgia. Then base of the tongue. Here if you see involvement of the base of the tongue like tuberculosis or malignancy leads to otalgia. Then elongated styloid process. An elongated styloid process can cause otalgia also. So that was all about the otalgia, which is referred via we talked about the fifth cranial nerve, then we talked about ninth, 10th cranial nerves, and also we talked about C2 and C3 spinal nerves. So all these nerves involvement can cause otalgia, and that's mainly the causes of the referred pain. So thank you for watching sqadia.com.